I had an interesting discussion with a friend a few weeks ago about the risks of smoking and how it damages the skin. Being a young lady in her 20s, she was of the opinion that if she invested in good skincare products and treatments, she would be able to protect against the undesirable effects on her skin. It's common for individuals in their teens and 20s to believe that smoking doesn't affect their skin health significantly because they do not see the immediate consequences during those years. In the teens and 20s, collagen is usually still robust, and even if a decline begins, it can take some time to become visible. This younger generation may also admire celebrities of a similar age who smoke and appear to resist any negative consequences, usually due to expensive treatments that they can afford and possibly filters and makeup. It's important to be realistic about smoking and not romanticize it. There are no benefits to smoking. Zero. Not even one. The multiple risks, however, are well documented. We know that smoking damages the lungs, causes cancer, heart disease, and more. But what happens to the skin? First of all, there are the small behaviors that smoking encourages that tip the first domino aesthetically. Smokers tend to pucker their lips in a particular manner and begin to develop characteristic vertical wrinkles on their lips. These are a telltale sign of a smoker's pucker. In the teens and 20s, while the collagen is robust, the wrinkles don't yet set in, but over time, as the collagen degrades, these wrinkles become more distinct and noticeable. Second, smokers squint their eyes to minimize the irritation from their cigarette smoke. This results in wrinkles around the eye area forming earlier than normal. It is also common for smokers' lips, gums, fingertips, and sometimes even their facial skin to develop a yellowish hue from the smoke exposure. The greater risks, however, stem from the internal damage that the body is subjected to. There are a large number of toxins that enter the bloodstream through smoking, and these circulate around the body, being transported to all tissues where they cause oxidative stress and direct cellular damage. This, of course, extends to the skin, particularly the dermis, as this is the deeper layer of the skin that is fed by a network of blood vessels and capillaries. This onslaught of toxins and free radicals damages the collagen structure of the dermis, causing the skin to become weaker, less elastic, and prone to premature aging. Pigmentation is also a high risk factor for smokers, since nicotine particles cause melanin deposition. Small particles in the smoke as well can be transported to the skin after inhalation and circulation in the bloodstream, and they can also penetrate the skin through the air, particularly when there is poor barrier protection. Once deposited in the skin, these tiny pollutant particles cause an inflammatory response as the skin attempts to defend against them. One of the skin's defense mechanisms is to produce melanin, since melanin is anti-inflammatory and antioxidant. Ironically, the pigmentation that develops from smoking is a result of the skin trying to protect itself. Smoking also damages the integrity of the blood vessels, constricting them and making them more rigid. These physical changes interfere with the ability to effectively transport blood to and from the skin, depriving it of fresh nutrients and oxygen. Over time, the skin becomes dull, lifeless, and devoid of any vitality. There are some interesting photo studies that show the difference in appearance between non-smoking and long-term smoking identical twins. The long-term effects of smoking can't be underestimated and should be a serious consideration. What commonly happens is that at some stage, smokers realize that cigarettes are harmful and switch to vaping, which for some odd reason is believed to be a healthier alternative. However, many vaping solutions are made with polyunsaturated oils that are heated, vaporized, and then inhaled. These polyunsaturated oils are extremely unstable and prone to oxidation. Once inhaled, they are absorbed into our circulation, where they will be assimilated and subsequently become part of our cells, contributing to further oxidative stress and inflammation. Residue of these oils also builds in the lungs, affecting the lung tissue's ability to function properly. After thousands of young vapors rapidly developed life-threatening lung conditions, Juul, which was the vape market leader in the United States, settled a class action lawsuit for around $500 million. When it comes to smoking, there isn't a gentle way to put it. It just isn't good for you in any shape or form. Most of us already know this, but find rationalizations for our self-sabotaging habits. The only reason we do this is because we don't see the immediate consequences. The danger of this mentality is that by the time there are consequences, it may be too late to remedy them. Your health is the most important factor in your life that you can take care of. When your health is at risk, nothing else matters, not your money, your job, or your status. You would give anything you have to return to good health if you have a serious health scare. Why tempt fate and put yourself in that situation? Protect yourself now and put away the smokes. For good.